Hello, everyone, and welcome back to Atlantic Coast Aesthetics. I'm your live streaming host, Matt, and today Dr. Thomas Pane joins us. And just as a side note, we'll be rebranding the channel soon to Dr. Thomas Pane MD, so just be on the lookout for that. Dr. Pane, we had a question that came up today specifically for a mommy makeover, so maybe you can just touch on that question and uh, let us know your opinion and expertise on and how the surgery went.
Yeah, so the question was basically someone's going to be having a mommy makeover and has very large breasts, and they're not sure whether they need to have a nipple grafting procedure. They've been told the breasts are large and that the nipple has to be, taken off as a free nipple graft. Let me just go into the background a little bit of what that means. When we do a breast lift or reduction, the scars on the outside of the breast, it's like the inverted T scar, circle around the areola, then down the breast and under it in the background, the base curve. What's being done inside changes depending, on the technique used, even though the scars on the outside can look the same. When we do a breast lift procedure, preserving the nipple is carried on a block of tissue as it's brought up. So even though the scar goes around the areola, that doesn't mean the areola has been taken off like, a manhole cover in the street. It's lifted up and moved somewhere else. That's not really what's going on. It's being carried on the tissue. So the sensation and blood supply to that nipple should be intact. And that is how I do the vast majority of my breast cases. It is very rare in my practice for someone with a primary, for a breast reduction to be so large that I cannot save the nipple, so to speak. If it's too big, the tissue that is being brought up, the breasts are too large, then sometimes the nipple has to be removed as a free nipple graft. So it's like a little flying saucer, it's taken off, the tissue is reduced, and then a little bed is made, and the nipple is placed back down as a skin graft. And then when that is done, the sensation is lost, there's an inability to breastfeed, and it just doesn't look quite as good as if it's carried with the natural tissue. In our practice, that is very rare because the people that taught me how to do these things, I think, were really, really good. I know this because when I was in my training, I learned a lot of the breast reduction techniques actually from my plastic surgery rotations in general surgery. And the person was essentially an expert in this. And I didn't quite appreciate at the time how expert until I went to a plastic surgery residency. And most of the people now teaching me these breast techniques, I would learn with them and I would say, this is interesting, but the rotation I was on in general surgery, that person was really, really expert. There were a few people in plastic that were in that range, but the majority were not. That's interesting and a subject of an entirely different topic. So I use a combination of the techniques, but a lot of that was what I learned on that first rotation. So that's why I don't have to take the nipple off as a free graft very often. Occasionally, somebody will be so large that there's simply no way to close it properly without it. But for me, that is a lot less than what you might hear elsewhere. Now, where I will do some free nipple graft techniques is when someone it's a male to female gender transition top surgery, then in those cases, we want a flat chest. So in those cases, we do a nipple graft when the breasts are larger. When they're smaller, we may not have to do it. And if I'm doing a gynecomastia procedure, this is a male with large breasts. Again, he wants a flat chest. In some of those cases, when the breasts have gotten real large, then the grafting procedure is advantageous because I can give you a one-stage flat chest without the disadvantage of trying to preserve a nipple and having a secondary mound, so I'm having to reduce that. So that's what has to happen sometimes, or by design when we have those special situations. But for the routine woman with large breasts who's having a mommy makeover, it is unusual, even rare, for me to need to do a free nipple graft procedure. If I think it might need to be done, I will have that discussion up front. We'll talk about it, and then I'll mark for it. But I can say I cannot remember the last time that I had to do one that I didn't know for certain I'd have to do it. Like if it's way down on, like breasts are on the thighs or down to the knee or something, it's different. But in the majority of cases where I will say, well, I don't know, let's see what happens. The breasts are down close to the belly button level. The nipple is down maybe at the belly button level. In some of those cases, I've actually not needed to do it. So I'll mark you for it. And then we'll find out when we get to recovery, it wasn't needed. So that's the typical situation. Now, that being said, real large breasts, even if you don't need to do the nipple graft, sometimes the largeness of the breasts stretches out the nerves and people will have very little sensation even without any surgery. So I always try to assess like what's your sensation situation beforehand. And even if the tissue is preserved, you never really know 100% if you're going to be able to preserve it afterward. But as long as you're not cutting the nerves, and the techniques I use, I don't cut the nerves directly. I don't expect people to lose sensation. It's a possibility, but it's not the rule. So that's what the combination is when you're talking a breast lift as part of the mommy makeover, either lift or reduction, along with the mommy makeover part, which is the tummy tuck side. So it's basically breast surgery and tummy tuck combined in one operation. We do a lot of these. I'm very picky about trying to make sure we get real good outcomes because it's one of the bigger surgeries in cosmetic plastic surgery, doing a mommy makeover. So I want to make sure that patients do well. I don't like to see when I see in the news somebody has an issue with somebody with recovery. I don't like to see that. So that's why we want careful patient selection. And sometimes people may have maybe a big BMI, maybe they have health issues. We may, for safety purposes, divide it into two separate procedures: breasts one time, tummy another time. Most of the time, though, with optimization, we can do it in one. And I like to do that so that we have a nice, safe outcome. So I'm not reading about anything. Like I said, if somebody goes elsewhere and somebody's getting too cavalier about who they put under surgery when they don't need it, then it doesn't reflect well on what we do. This is a safe procedure because even though it is a big surgery, it is not as big, say, general surgeries or big orthopedic procedures in the hospital, things like that. Those are much larger. So that's why even a mommy makeover is something that we do as an outpatient. We expect good outcomes, routine type work. It is not as big as C-sections, having a gallbladder out, something like that. So that's the basic overview of how it works and the role that free nipple grafting plays in our practice. Very limited when it's breasts alone, and it's more common when it's special situations like large gynecomastia or somebody doing a transition from female to male, where we would do the grafting as part of the design because you get better outcomes in those particular subset of patients. So hope that covers it. A lot of information there, but we always like to take the questions. So just keep sending them.
Sounds good. Thank you, Dr. Pane. And if you have a question for Dr. Pane, please visit the description below, and all those social media links will be there. And Dr. Pane, we appreciate your time, and we'll see you on the next question.